I'm going to go over with you a McKenzie extension exercise. This is for anyone dealing with back pain or sciatica. You can give this a try. As always, I do recommend that you consult with a physical therapist before trying to go through these exercises, just to make sure that they are appropriate. So with the McKenzie exercises, you're going to lay on your stomach like so, and you want to put your hands underneath your shoulders. And so we are just doing the press up. And so when we do the press up, we're going to press up, keeping our butt down, and we want to push as far as we can tolerate, and then back down. So you want a little pause and then back down. And typically, I recommend to do 10. So I'm going to do 10 of these, just like so. Now, what I'm looking for when this happens is a couple of things. One, I want to see centralization occur. So centralization, and I've just got a couple more of these. Perfect, that was about 10. So centralization is when the pain, say if it's in your leg or your butt, your calf, your foot, we want that to come out of the extremity. So if it's in the foot, I want to see it come out of the foot and closer to the back. Now, it is okay that back pain may get worse. That is okay as long as the symptoms are getting better in, say, the leg or the buttock. We want to see them centralize towards the low back. That's why we call it centralization. What we do not want to see is peripheralization. Peripheralization is when the symptoms go further down the leg. Now, some people may notice with peripheralization that the back pain actually gets better. It's less, but now it's more in your butt or your hamstring, your calf, your ankle, your foot. If it's getting worse down the leg and those symptoms are getting worse, that is a sign that you need to stop. And I would recommend then consulting with a physical therapist or a McKenzie trained expert, so that way you can get more one-on-one care. That's a bad sign, is peripheralization. So if those exercises, the extension exercises, are working, you have what we call a directional preference into extension. So that means that your body likes extension, and that tells me we need to keep going into extension. So with those prone press-ups, usually I'll start someone off with 1 to 3 sets of 10. And if things are moving in the right direction, we're going to continue to do those prone press-ups. Now, a way to progress that is, say you start to plateau, those exercises are working, and you start to plateau, you can add what we call a sag. So with a sag, you're going to press up. We want to keep then the butt relaxed, and I want to breathe all the way out, exhale, and sag through the belly. Pause, and then down. So it's press up, fully exhale, sag through the belly, make sure my butt's relaxed, and down. And you're going to do a set of 10 just like this. Just like so. So that is a way to progress the McKenzie exercises, to add a little bit of that sag or self-overpressure if you're plateauing with just the basic press-ups. Give those a try. If you have any questions, please put them in the comments below, and I'd be happy to answer those.